So I recently did a video on why everyone is getting shingles. I'm going to put that link down below if you haven't seen it yet. And I noticed that there's quite a few people that were experiencing shingles after they had the COVID-19 vaccine. So I wanted to do a video on post-COVID-19 vaccine shingles to give you a little more information on what I found when researching this topic. So there has been an association with various skin or cutaneous manifestations. And that includes conditions like diffuse erythematous eruptions, which basically is kind of like a scattered rash of redness. Then you have another condition called urticaria, which is like hives. You have these itchy red little dots, as well as chickenpox like skin lesions or fluid-filled blisters. Now, this data is in America. It's not in other parts of the world, but the Johnson-Johnson vaccine, which only requires one dose, they don't seem to have any reports of any type of shingle outbreaks. Now, what's different about that vaccine compared to the Moderna and the Pfizer vaccine is that the Johnson-Johnson vaccine used the traditional virus-based technology, as compared to Moderna and Pfizer used the messenger RNA technology. And so it appears, based on the data, that the shingles outbreaks are more related to the messenger RNA than the traditional virus vaccine. Now, on February 5th, 2021, there was the first report of shingles after a vaccination, which was from the Las Vegas Dermatology Clinic, which I'm going to put a link down below. And since then, they had 5 more reports, and there was also an additional 14 that was reported or documented on social media. So in my last video, which I'm going to put a link down below, there were a handful of people who experienced shingles after getting the vaccine. And I want to talk about the reason why that could be. So first of all, we're dealing with strong vaccines, which have not gone through the usual testing, like 3 to 4 or 5 or more years, so they can really figure out the dosage. And so you have two things. You have what's called an antigen, which is a toxin or a substance that your immune system is reacting to create antibodies or immunity. And you also have something called an adjuvant. Now, that is something that is enhancing the immune reaction with this antigen. And so some vaccines use aluminum, which, don't get me started on that topic. They also use other ingredients like soap-like chemicals, polyethylene glycol, and even the lipid nanoparticle that transports this messenger RNA can act as an adjuvant. And so when someone's exposed to both of these component parts, there's going to be a lowered immunity for about 2 to 3 weeks as the immune system is reacting and generating its antibodies. And then on top of that, we have people with a weakened immune system, whether they're getting older or they have metabolic syndrome or some other pre-existing health problem. That's going to add a layer of complexity to this immune reaction. And then compounded on top of that, we have an entire population who either had the chickenpox or who had the chickenpox vaccine, which means basically that they have this virus that is in their body waiting dormant that can be reactivated by this vaccine and a weakened immune system. So that's probably what's going on. But now the question is, if you have shingles, what can you do about it? For that data, check out the link down below.